You know, we've all noticed it, the thickness in the air. We've seen the ash. We wondered about the health effects of this. So Matt Hoffman from the Multnomah County Health Department joins us right now. And you were just telling me that downtown Portland, the metro area, is classified as what in terms of air quality?
As of now, I would say downtown is classified as unhealthy for all groups, which is kind of our middle designation for air quality. So it's certainly not healthy to be outside, but there are areas of the state that are significantly worse right now.
Matt, who is most at risk? Who should really heed the warnings and stay indoors today?
So our messaging for those folks would be geared primarily towards older adults, children, people with existing cardiovascular or respiratory disease, COPD, folks that are really a little bit more vulnerable to the smoke. We know that children breathe about, on average, twice the amount of adults per pound of body weight, and so they're really getting a lot of air in and out of their lungs, and they're developing as well, and so that's something for us to pay attention to.
Does the presence of the ash, I mean, we saw the smoke in previous days. Now all of a sudden this ash, which makes it even more scary, I think. Does that ash itself increase the health risk?
I can't specifically speak to that ash. Generally, when we look at particulate pollution, the smaller it is, the finer the particulate, the more harmful it is to our health, because it can get past our natural defenses and get back down into our lungs and enter the bloodstream. So when it comes to that larger particulate, I don't think that's quite as much of a risk, because that tends to get stuck on our tongue and our nose and things like that and filter out.
Do you recommend, should most of us be wearing these masks, at least if we're going to be walking outside, the surgical masks? I mean, is that one way of preventing?
Well, I think it's one action you can take. One thing I'll caution about those masks is that if you're going to use some kind of mask, use an N95 mask, which is of a thickness that will catch some of that fine particulate that's associated with smoke. Otherwise, there are larger respirators that you can wear, but those are advised against generally because you can't have facial hair like I do. You have to have a clean-shaven face. You're supposed to be fit for them. And generally fitness tested for them in the sense that they kind of restrict the air that you breathe as well, impose some more negative pressure, and so especially for folks that are having a hard time breathing, we might recommend against that unless you've had proper training and certification.
But you said an N95 mask. Where would I find one of those?
So those you can find basically at any hardware store,
medical supply
places, Home Depot, any of those.
But you want it to be an N95.
N95 or better.
Matt, I've just got to ask, just from a personal perspective, what's your thought when you see this video, the photos of the devastation?
Well, it's disheartening to me, certainly. You know, I woke up this morning and my car was covered in ash, and it's sad to see this amount of timber going up in flames, but my real concern is with the smoke that these fires are producing and the impacts on air quality. And some of the communities in Southern Oregon have been dealing, and Central have been dealing with this for weeks and weeks and weeks, and it's just not healthy.
No, not at all. Well, Matt, thank you again with the Multnomah County Health Department. We appreciate all the work that you and your office is doing.
Very welcome. Thanks.
We'll be back with more just after this.